Is there no sound with this? Sorry about that. So around 2000, I started using Botox back in 1997 in Australia. And in the beginning, when we were just letters or these articles for the Irish Medical Times, is that some surgeons in Ireland started putting in the papers, Botox will destroy the next generation. And we were saying, no, Botox will be the wonder drug of the next generation. So the editor of the Irish Medical Times asked me to write a series of 4 articles on Botox and its use in strokes, its use in trigeminal neuralgia, its use in chronic migraine. When I started injecting chronic migraine, it was in 1997, and a lot of doctors actually wrote in the Irish Medical Times, this is nonsense, Botox can't be used for migraine. And it wasn't until 2010 that it actually was passed. And so we were doing it 13 years before. So I started to get the cases in. I mentioned this case because even though we know now you get an eyelid ptosis and it's easy enough to treat, this patient went to a doctor who told her that was permanent and it couldn't be repaired. So really, we forget with the new generation of doctors that when Botox started, a lot of people were afraid of it. So for ptosis of the upper eyelid, we know that we can use iopidine or also phenylephrine. Phenylephrine, the problem with it, of course, is the mydriatic. It widens the pupil. And with iopidine, in a small number of cases, you can get an allergic eye. So I don't need to go through ptosis, it's very straightforward. This patient came to me in 1999 with this condition, which you probably recognize as blepharospasm. And before anybody treated this, I certainly was the first that I know to inject her in this area, and 1 week later she was like this. Now, when we talk about doing a lip flip with Botox, which is very popular at the moment with Botox in America, Britain, and Ireland, it is the same procedure. You've got an orbicularis muscle in this pretarsal and septal, and you just inject one bit of it so the other bit lifts it up. So that was 2003.